Hi, good evening. Can everyone hear me? We're ready to start today's Doctor's Talk, brought to you by Healthy. I would request you to please type out yes if you can hear me clearly in the chat box on your right. That would really help us understand if you can hear me clearly. And I would like to just introduce myself. My name is Tara. I'm the moderator for today's session. So I'll just wait a minute to see if someone can type out yes. Anyone from the audience, please type out yes in the chat box on your right. Okay, so I hope everyone can hear me clearly. If nobody can, of course, what I would recommend is that you can please drop off and then join the session again. Maybe there's just a network connectivity at your end. Well, I just want to introduce the person that you can see on your screen. Joining us today, we have Dr. Kavita Lakshmi. She's a senior consultant who completed her MD in obstetrics and gynecology from Madurai Medical College in 2003. Her expertise lies in high-risk pregnancies and procedures related to infertility treatment. She has been practicing for over 20 years now and is a senior consultant at Motherhood Hospital in Bangalore. So before Dr. Kavita shares her screen and starts the presentation and talks to us all, I would like to encourage the audience to ask your questions during the session. Let's make this an interactive experience. I will moderate the chat box and convey your queries to Dr. Kavita. But over to you, Doctor. Please do feel free to introduce yourself and start the session. Thank you.
Thank you so much for the kind introduction, Ms. Tara. And I think you have introduced me enough. I'm Dr. Kavita Lakshmi Ishwaran, and I'm a consultant obstetrician in Motherhood Hospital, HRBR. And it's my pleasure that I can come and do a webinar with you. And thank you so much for the well-coordinated work that you have done. And Ms. Tara, if it is okay, I can start the session. You let me know when I can start the session.
Yes, Doctor. I will just go ahead and share your screen so that everyone can see it. I hope everyone can see the presentation now at your end. Dr. Kavita, you may begin when comfortable.
Yes, thank you so much. So I would like to start the session by saying that, by defining what is health, and since we are going to discuss about women's health, I would like to start the slide by showing why it is very important to know what it means by being healthy. So health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And this is what the WHO has defined health as. And like the elders or our ancestors have wisely put it, it only means health is wealth. Because unless you are healthy, you cannot do anything else. And when we come to the components of health or wellness, there are 8 major components. So in the physical, mental, and the the social health that we deal with, these 8 components fit into any one of these, which are seen on the screen. Like it starts with physical health, then it goes on to intellectual, spiritual, and emotional health, which comes as a part of the mental health. And then you have your own social, occupational, financial, and environmental health, which comes into the social well-being as well. So I would first try to tell you what I would be saying in the next couple of slides. So this mainly deals with the health challenges that women face right from the time they are in their mother's womb till the time they attain menopause. So the health challenges starts from when you are intrauterine, that is when you are in your mother's womb, and then it goes on to once you are born, and then when you are a child, and then when you become an adolescent, and then you become a young unmarried lady, and then you become a married lady, and then you go on to being a mother. So you go through your reproductive phase in your life, and then you go on to you enter into a phase of menopause, and there is a short couple of years before menopause, which is called a perimenopausal age group. So the challenges are going to be discussed under these said headings. And the health challenges, like is seen on this slide, I would first deal with the early months of, when you are in your mother's womb and as a child. The women, especially in India, I mean, I would rather discuss this more on an Indian scenario. This slide discussion may not always comply to general women across the globe. So as in when you're inside your mother's womb, whether you like it or not, or whether people would accept it or not, there's a lot of gender discrimination when it comes to our Indian population. So in the early months of being inside your mother's womb, a girl child is definitely, I wouldn't say in the entire Indian population, but at least to certain strata of society, in all walks, I mean, in all socioeconomic levels of society, there is definitely a gender discrimination where the girl child starts, there are sex selective abortions which are happening. And then it comes on to nutritional problems. If, the mother hasn't eaten well, so there would be anemia and malnutrition. So then the growth is also affected. And, as that is more so in childhood. I wouldn't put it as an intrauterine thing, but in childhood, there are families and different socioeconomic strata in the Indian population, wherein the girl child is given lesser food and lesser, education, and there's a lot of violence and abuse happening to the girl child. Then we go on to the adolescent or the adult phase, where the girl child goes through a lot of, once she attains menarche. Menarche means the first time she gets her period. So from that point of time, the first 2 years is a little challenging because there would be a lot of irregularities in the period. There are girls who have a lot of immaturity in the hypothalamo-pituitary ovarian uterine axis, which means that there is a lot of hormonal imbalances which the girls face at that point of time, wherein they have a lot of bleeding problems and other puberty changes, psychological changes during the puberty phase and the early teenage phase. Then they go on to late teenage problems like unwanted pregnancies, if either by not knowing what the contraceptive measures are, or because of rapes that happen or incest that happens. So a girl child is always vulnerable to certain sexual harassments and those kind of complications related to that. And there again, we can, connect it to violence and abuse as well. The second, and another thing that happens during that age, which happens without knowledge about what it can affect them, is onto smoking, alcohol, and substance abuse. So this is also becoming a major challenge in our younger generation, from the point of, say, late teenage to early adulthood, till they, go on to their reproductive age group. One important one major problem that many adolescents and adults are facing is the problem of polycystic ovarian syndrome. And this is basically a genetic disorder which you inherit. It is not something which you can modify the gene, or you can change the gene. It's something which you are born with, and the only thing you can do is modify the effects of the gene by following a healthy lifestyle and a healthy, overall healthy lifestyle. If you want me to discuss more on it, I can always do that. If anybody has a doubt on PCOS, I can definitely extend my, topic on that. So you may please message to Ms. Tara. She will put across the question to me. Now, coming on to after 45 years of age, see, usually in an Indian scenario, though we say 50 to 52 is the menopausal age, any menopausal average median, if you take a an extended range. It can happen anytime between 45 and 55 years in the Indian scenario. So menopause is something which, a lady who has been always on hormones suddenly, doesn't have those hormones which make her, what she is as a woman. So she's suddenly, denied of those hormones which she has been living with all the while, and she has to cope to those hormonal changes and those imbalances. And the deficiencies of hormones can create a lot of complications post-menopause, which I would be discussing in the slides, which I would discuss in detail later on. And osteoporosis is again thinning of the bones, which especially happens after menopause, which again I'll come on to in the next couple of slides. Violence and abuse is still there after the age of 45, because she's no more a productive lady or a lady who can do everything that is expected, out of her. So, sometimes there are a lot of women who don't have anybody to take care of, and there's a lot of violence involved in that age as well. Medical conditions other than diabetes and hypertension or hypercholesterolemia, or could be cardiac problems or lung-related problems like COPD, cancers with relation to ovaries, uterus, and breast, and mainly in these three scenarios, other than the general cancers that she might, get into. And of course, depression because of the sudden withdrawal of hormones that happens after the age of 45.
So doctor, we do, sorry to interrupt you, we do have two queries that have come in. One person has said that, yes, I would like to know more about PCOS, and, considering that this particular lady is overweight, there are two queries on PCOS. And another two queries on also thyroid issues. So if you could please talk about these two issues during your talk. Thank you.
I would say PCOS is an inherited genetic disorder which runs in families where there is diabetes, and because the same gene which causes PCOS is also there in a patient who has diabetes. So basically, it's a condition where there is an insulin, there is a resistance to insulin, which is one of the hormones produced by the pancreas. So in PCOS, there is a resistance to insulin where because of a high, when there is a resistance to insulin, there is a compensatory increase in the in the production of insulin in the body to compensate for that resistant insulin to act on the body. So there is a hyperinsulinemia, but which is resistant to its action. So what happens is in PCOS, there is a hyperinsulinemia which is resistant, and insulin has a growth factor like effect. So it tends to increase the weight of the patient because of the growth factor like effect. So patients with PCOS are usually and mostly obese or overweight. And what happens is it's a vicious cycle. When the number of fat cells goes up, there is more and more insulin resistance. There is more and more, worsening of PCOS. And in turn, the patient puts on more weight in spite of whatever lifestyle changes that she tries to do. So like I said, since it's a genetic disorder, we cannot change the gene. We cannot modify the gene. We don't have the genetic engineering to go and change something which you have inherited, and that too at the DNA level or a genetic level. So the only thing we can do is to modify the effects of the gene. So try and reduce Okay, there's another query. I'll just answer that query after this. So if there is a resistance to insulin, the only way we can bring it down is to put them on insulin sensitizers like metformin, and there are other N-acetylcysteine and other treatment options that are there, and try to bring down the weight by following a good exercise regime and being on a good diet, like basically being on millets and other things which will help her reduce weight and keep the weight under normal limits. And many a time, what we see is following a healthy lifestyle itself helps us modify the worsening of the disease, like, healthy diet, avoid junk food, avoid smoking and alcohol, do yoga, pranayama, meditation for de-stress, because stress also is a contributory factor. Keep all the medical disorders under control, and also exercise so that your body fat index doesn't go up and worsen the disease. Now, it is a very wide range of problems. It would take me another full session for another 1 or 2 hours for me to explain what is PCOS in detail. But the gist of the whole thing is that we can only modify the effects of the gene. We cannot change anything that we have inherited. And we can only do that by following a healthy lifestyle and do it consistently throughout your life so that, it doesn't come up and show itself in a bad way. So, and regarding the thyroid issues, thyroid is a gland which is seen in the middle of the neck, and usually in women, it is either in any age, any person, it is either a hypothyroidism where there is an underfunctioning of the gland, or there is a hyperthyroidism where there is an overfunctioning of the gland. Now, women usually suffer from problems. Majority of problems related to the thyroid gland are because of hypothyroidism, which is again an autoimmune problem where your own body produces antibodies against your own gland. So there are anti-thyroid antibodies which will, destroy the thyroid function, the thyroid gland cells, so that there would be, and so there would be a reduction in the number of thyroid cells in the body, and you develop hypothyroidism. And hypothyroidism is one thing which can cause a lot of menstrual problems and lot of other systemic problems, like it is not only affects the reproductive function or the menstrual function, it also affects the brain, the heart, the intestinal function, and overall psychological problems. It can create a lot of psychological problems to a lady or to a man as well. And hyperthyroidism again is involved in all the things that I mentioned about in this regard. Yes, Ms. Tara, if you want me to clarify any more things, you can just put it across.
Yes, doctor. There are a couple of more questions, and then I would ask the audience to hold so that you can move to the next section. But I'll just ask a couple of more questions. Number one, regarding PCOS itself, is that are there any, is it going to affect pregnancy? Can it cause issues during pregnancy? Are there steps that,
Yes. See, because of all these hormonal changes, the main problem why there is an irregularity in period or that there is a difficulty in fertility would be in getting, getting a baby would be because of these hormonal changes, a lady wouldn't be able to ovulate well, So, see, usually a lady has a regular cycle of, say, 28 or 30-day cycle, where we predict ovulation somewhere between the 14th and 16th day. Usually it is in and around the 14th day. But in PCOS, because of the hormonal changes, they wouldn't ovulate at all, or they might have an erratic ovulation where they ovulate a little later, say like on the 21st day or say on the 45th day. So it is only after 15 days from ovulation that you get a withdrawal or a period. And if they don't ovulate at all, the period gets delayed for a considerable period of time. Now, the egg is viable for 24 hours, whereas the sperm is viable for 48 hours. So, if during the time of ovulation, a lady has not had an intercourse at that point, she may not be able to conceive. So, for a patient who has had an irregular period, say a 45-day cycle or a 60-day cycle, and which keeps jumping from 45 days to even 3 months. There are PCOs who don't get a period for 6 months or even without withdrawal. So for us to say whether she is fertile or not, we need to evaluate, and we have to help her ovulate by giving ovulation induction and track the ovulation with follicular scans and help her to conceive. So I wouldn't say all PCOS are infertile. They would be ovulating, but there would be a problem in ovulation. There would be a delay in ovulation. Sometimes there would be no ovulation, and there could be unhealthy ovulation as well. So we need to work it up and make sure that things are fine before we can tell them that no, there is an element of subfertility or there is an element of treatment that you would require. Many of the PCOS respond to medical management in terms of reduction of weight, in terms of keeping, modifying the action of the gene, like what I said, following a healthy lifestyle and following a healthy dietary pattern. Yes, Ms. Kara.
Yeah, thank you, doctor. We'll just close this pretty quickly so that you can move on with the other slides. There's someone who would like to know regarding a particular tablet. Would you feel comfortable talking about certain tablets right now? Or?
Yeah, why not? Please.
Yeah, it's a MEPRATE tablet, MEPRATE. Yeah, for regular cycles.
A trade name. MEPRATE is a trade name for medroxyprogesterone acetate. It's a progesterone, and it is given for withdrawal or for bringing in a period for a patient who has not got a period. It is also used for postponement because it is progesterone which can postpone the period. Now, what would she like to know about MEPRATE? MEPRATE is not a mainstay of treatment. It is only to get a withdrawal for a patient who has not got it on time, or she wants to postpone it for some other reason, like say a function in the family or something of that sort. Yeah. What would she want to know? It is not the mainstay of treatment. It is only to withdraw a period or to bring in a period for a PCOS who has not got a period, say, for more than 45 days or 60 days. And it is very important for a patient to have her period at least once in 30 to 45 days and not cross beyond that, because a cumulative effect of the hormone because of an anovulatory cycle, which is estrogen, can cause a long-term effect and an early onset of diabetes, hypertension, an early onset of ischemic heart disease, and hypercholesterolemia and hyperlipidemias. So it's very important to bring in a period for a lady who has PCOS at least by 40 to 45 days. Otherwise, any lady is very happy if they don't get a period every month. Who wouldn't be happy? I would have also been.
Thank you, doctor. I think I have a couple of more questions, but if you feel comfortable to continue with your session, audience, I would request you to hold on. I know there are certain questions that have come through, but maybe we should proceed with the session for now. And again, we can come back to question and answers at the end. If you have anything relevant to the slide, please feel free to ask. Thank you, doctor. Please go ahead.
Yes, Ms. Dara, thank you. Yeah. So going on to, I would first start with gynec health and then go on to pregnancy and lactation. What we need to know at that point, and then also bring in COVID, which is a super highlight at this point. Now, coming to the gynec health, that bleeding and discharge are a normal part of any menstrual cycle, but any unusual bleed or any unusual discharge has to be taken care of. Now, any bleeding in between periods or any heavy bleed during periods or any pain during the periods is something which we deal with bleeding disorders. Any frequent urination is a sign of a urinary tract infection, which also comes with a lot of women deal with this urinary tract infection during their from childhood to menopause as well. And then any unusual bleed can mimic other health conditions like cancers of the reproductive tract, starting from the uterus to the ovaries, to other organ secondaries as well. So it is very important that any bleed which is more than 5 to 7 days and which is unusual and like what the points that I mentioned, and which it can be, it has to be evaluated. And any delay in the periods also has to be evaluated. Now, vaginal issues like an abnormal discharge is mainly because of a candidial infection, but it can also, or any vaginal infection, but it can also indicate very serious problems like reproductive tract cancer. It might present first as a discharge and then as a bleed. And it also means that there could be any sexually transmitted diseases. And so if left unchecked, it can cause, infertility and a lot of medical problems, worst among them being a renal failure or a kidney failure. Now, coming to pregnancy and COVID-19, this has been the main reason why I'm here for the webinar, because people are worried about what would happen to a pregnant woman who's COVID positive, or what should we do so that we don't get the disease. Now, the current scenario where we are more than 2 lakhs in India as being COVID positive, it is very important for us to know whether you're pregnant or not, what to do, and what should you do, and what should you know so that your near and dear ones who are pregnant has to follow safety precautions. Now, first and foremost, I would like to start saying that pregnancy is an immunocompromised state because there are a lot of hormones, steroidal hormones, which are playing there, and an immunodeficient state is created because of this hormonal change. And pregnant women are therefore more vulnerable to any disease and any infection, and hence to coronavirus infection as well. So no prophylaxis can be given to a pregnant lady. That is very, 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 that is the highlighter of the whole thing. So prevention is always better than cure, like we always know. So prophylaxis can only be in terms of preventive measures. Prophylaxis and treatment with HCQ, which is the mainstay of treatment. HCQ is hydroxychloroquine, which is the only treatment that is recommended now for a COVID positive case, is relatively contraindicated to pregnant women. So with a low immunity and with a drug which can be relatively contraindicated and which can harm the baby, a drug which has very serious side effects to the level of a cardiac arrest if she has a compromised heart, and more so in pregnancy, all the heart functions are increased, see, like the cardiac volume or the blood volume, everything is increased by 1.5 to 2 times. So there is already a cardiac overload, and we have to use HCQ with a lot of precautionary measures. Otherwise, we can have a compromised heart for the mother. And at that point, we wouldn't know, who's more important, because HCQ can be bad for the mother, it can be bad for the baby. And it will become a very highly complicated situation to treat. So, in pregnancy, the preventive measures are very important. Now, you need to know what are the main preventive precautions. Now, many of this has been highlighted in most of the websites. A regular hand washing with sanitizers, and a very good sanitizer is very important. Social distancing has moved from 1 feet to 2 feet to 6 feet now, and we really don't know if social distancing is really helping the way in which the numbers are increasing, but we need to follow that. Avoid contact with the people who are either showing symptoms. But one thing here I would like to mention and highlight is that 80 to 85% of corona positive patients are asymptomatic. So you wouldn't even screen them. So there again, social distancing and being at home would be better. Working from home would be better. So avoid non-essential use of public transport, avoid large and small gatherings, even with family and friends, and use an online consultation mode to consult your doctor as much as possible rather than come to hospital. Though we do follow a lot of precautionary measures, we do follow a lot of preventive measures, we really don't know which asymptomatic patient is walking in. So it is always better to come to hospital only if there is a need for essential scans at appropriate periods, or there is a need for investigation at that point of time, or there are complications, or there are any medical issues that the patient is facing. Again, avoid touching your eyes, nose, and mouth, because that's the commonest route through which this virus spreads. So covering your, nose and mouth with a mask. Now, I see a lot of patients and a lot of people on the road not covering the mask, using the mask completely. It is like using it here or here, and the excuse that they give is that they cannot breathe. But if they breathe whatever they are breathing, and if there is, an aerosol pollution, aerosol contamination with a COVID, aerosol release, then that's the major mode in which it goes. So, put the mask very clearly, even if it's suffocating, it's better than, not, getting infected. So it has to cover the nose up to this level, and it has to cover the mouth at this level. It is not just for the garment's sake that you're using it. It is to protect yourself, and use a goggle or use something which will close your eyes. Don't go and touch anything on any surface. If you have, touched a surface, keep a sanitizer with you, and, rub it immediately. In case of any symptoms, screening is required for pregnant women as well as for their family members. And use a mask all the time, which I have already mentioned. And as a policy in our hospital, we do screen for a patient who requires delivery or for any emergency interventions that we do. And we are in close touch with our patients so that we don't miss a case which is COVID positive, because that can take a heavy toll on all the other patients who are walking in and to the institution per se. So this thing is not one-sided. All pregnant women and all women around them need to know what has to be done. Now, coming to the pregnancy issues, like I said, pregnancy being an immunocompromised state or an immunodeficient state, any pre-existing conditions can worsen during pregnancy, threatening the health of the mother and the baby. So people who are more prone to, more prone other than, pregnancy itself would be women who have diabetes or gestational diabetes, hypertension or gestational hypertension, which is mentioned here as pregnancy-induced hypertension, any asthmatic, any person with a chronic obstructive pulmonary disease, that is disease related to the lung. Depression again can pull down your immunity. Anemia can pull down your immunity. And the third trimester, that is the last 3 months of pregnancy, can also be a more, immunodepleted state. So it can harm the mother and the child during pregnancy if not managed properly, and it can make them more prone for COVID infection as well. Another problem which can arise during pregnancy is an ectopic gestation, which means the pregnancy happening in the tube or anything outside the uterus. So we need to call patients for certain scans in the early pregnancy stage. So scans are also important. Investigations are also important. We cannot afford to miss an anomaly in the 3rd month or the 5th month. And there's so many implications in growth which can happen during this lockdown phase and, confinement at home. So we need to call patients on time and do the necessary things. We cannot afford to miss because we are answerable for that as well. So I would put it as a general headliner saying, that patients need to come to hospital as and when we call them. We would call them only if required and as and when required. And they have to come to hospital with and follow safety precautions while coming to hospital or being at home by having a self-responsibility of social distancing and following precautionary measures like I have mentioned. Unfortunately, we are able to manage and treat even before we had screening effects. And, rare health issues that have emerged during the pregnancy, we've been able to handle that in a very safe manner. And in a, by taking so much responsibility that we have always done. So to avoid complications, planning a pregnancy at this point, I wouldn't advise unless there is a very severe level of subfertility where, the ovarian reserve is coming down, and, we have put on by ICMR guidelines and WHO guidelines, we have put on any infertility or subfertility treatment on hold because of the exposure to the patient, to the hospital, and that they can catch the disease. So that would go against this one of confining, women or patients at home. So after the peak level of our infection comes down is when we would advise them to come back and plan for a baby. And before planning for a baby, you have to consult an obstetrician so that you would be put on good, pre-pregnancy vitamins like folic acid, so that there would not be any complications for the baby. Folic acid is supposed to, it has been proved through randomized controlled trials that it would prevent a neural tube defect in the baby, or any spinal defect and any neurological defect for the baby. So it is very important to start folic acid and correct other vitamin deficiencies and anemia at least 3 months prior to conception. Your partner's participation and cooperation is very important. So planning pregnancy when both of you are prepared, a couple is prepared for conception is very important. A reference system to to plan an effective management of complications is very important. So we need multi-speciality, disciplinary support to take care of all pre-pregnancy complications. So counseling before that is very important, and correct treatment before that is very important. Proper antibiotic checkups are required during pregnancy and at the appropriate time and as and when required. And iron and folic acid supplementation and treatment of associated infections is also very important, so that neither the mother or the baby suffers with it. So primarily you need emotional support and advice, good medical care, and relevant and timely pregnancy information and treatment. And it's very important to have a very good bond with your obstetrician so that you will be able to have a very safe journey during pregnancy. Now, after delivery, it is a similar scenario where you are still withdrawn of all the hormones which have supported you, and you are having an added responsibility of feeding the baby as well. So your health is very important. Your nutrition is very important, so that you have enough amount of milk and rich amount of milk, and the milk is good in quality, not only in terms of antibodies that you can transfer to the baby, but also in terms of enough amount of carbohydrate, protein, and fat in it. So your nutrition following delivery is very important. And a lactating mother is also more at risk for COVID infection than a general lady. And the baby is also at risk because here social distancing cannot be followed. Only a mask can, during the latching process, only a mask is something which can keep you away from the baby. So wearing a mask during breastfeeding is very important. And the mother has to wash her hands before and after touching the baby, and follow all precautionary measures. Prophylactic and therapeutic HCQ, which means giving HCQ as a precautionary measure or as a treatment mode when she is positive, can pass through the, can have a, is relatively contraindicated during lactation phase, and it can affect the baby. Special conditions dealing with pregnant and lactating mothers, like medical problems or immunosuppressant states during pregnancy and lactation, has to be treated with much extra precautions. And all these, precautionary measures have to be followed during lactation period as well. Coming to the breast care during lactation, wearing a well-supportive feeding bra is very important. You do get these feeding bras in the market. It is very important to first wear a bra and then wear a well-supportive bra. Otherwise, the breast can get engorged and collect excess milk. See, the more the space you allow the breast to sag, more and more milk would be collected, because feeding lactation is a let-down reflex, and it would just occupy as much space as it can. While you're feeding one breast, the other breast can get filled, and both the breasts can get filled if it's not supported to as much space as it can, hold milk. So if it is not supported, excess milk is stored, and if it's not fed on time, it can go in for engorgement. And later on, if that cannot be expressed with hot fermentation or breast milk expression, it can collect, it can form an abscess, and then you would require a surgery for it as well. it can cause infection and sepsis and worsen things that is happening. So it's very important to put use a well-supportive feeding bra and buy it and keep it before delivery so that it will help you post-delivery. You have to palpate your breast superficially for any pain, tenderness, because that would be felt as well. An inverted nipple so that you can, invert it by, pulling it or using a puller or, using a breast pump, or you have those pullers which are available. Inverted nipples or flat nipples need to be taken care of by either a massage using your fingers. You can try to pull it out, or you can use this puller which I mentioned. Look out for cracks because there is constant sucking by the baby, which causes a lot of dryness in that area. So using any kind of oil which you use before you have bath, like say olive oil or coconut oil before you have bath, and using nip care ointments which will moisturize the area would prevent these cracks. Any lumps in terms of collected milk or any other lump like a fibroadenoma, sometimes we have had chances where they have felt lumps during the feeding phase, just turned out to be cancer as well. So it's very important to know how to examine your breast on your own. There is a separate drill for examination of breast, but I wouldn't get into it right now because we are dealing with pregnancy here. So any lumps has to be expressed so that milk doesn't collect and cause all those complications that I told you. And any temperature changes which are associated with breast engorgement or, abscess or sepsis that happens, even a mastitis, that is, inflammation in the breast tissue, which happens when the baby bites or, you tend to have an infection there, it has to be noted. So doing hot fermentation and breast milk expression will not be required if you use a well-supported feeding bra. If it happens, you need to express it and not allow any breast engorgement. Why is breastfeeding very important? Exclusive breastfeeding up to 6 months post-delivery is recommended worldwide. It is a very strong WHO recommendation because it's a complete it is a complete species-specific food which will not do any harm to the baby. It is only a bonus that the baby has. There is no deficiencies related to that. And supplementary feeds are advised only from 6 months now. And breastfeeding is, advised to be continued until, the baby demands or the mother desires to feed her baby. Latching is very important for the psychological connect with her baby and the bonding that she can have. It is very important for the let down reflex, and this let down reflex is what produces enough milk. So latching is very important for breastfeeding to succeed. And correct positioning is very important while feeding for effective sucking. So you sit like this and you hold the baby down, baby will not be able to suck. And the posture for the baby, for the mother, is also very important. So always the mother has to sit with her back straight, with support in the lower back, keep a pillow, elevate the baby's head, feed without bending, otherwise the mother can get a backache. Baby will not have enough effective sucking. You can tend to choke the baby if the baby's head is low. Baby will not be able to effectively suck, it will not gain weight, and there can be a lot of soreness in the breast because the baby will continue to feed for a longer period of time because it is not giving milk effectively. So the benefits for the baby would be that, like I said, it's a complete food which is species specific. It is easily digested and absorbed. There's no question of indigestion there. And it protects against infection because it's very rich in antibodies that the mother has, inherited through her life, whatever acquired antibodies she has had, plus the, immunized antibodies in terms of a tetanus toxoid. So it prevents a lot of immediate infection before the baby can get its own immunity by getting its own active immunity through the vaccinations. It promotes a lot of emotional bonding and it's very important for the brain growth. What are the benefits to family and society? Of course, it's the cheapest things, most inexpensive thing which is naturally produced by the mother. It promotes family planning because it because it is breastfeeding. In breastfeeding, there is an excess of prolactin hormone which prevents an ovulation, and hence, when there is no ovulation, it is a kind of a contraception, relative contraception that you get. So that's the way it promotes family planning. So effective feeds, more than 8 to 10 feeds in a day throughout the day, is supposed to prevent ovulation. But don't gear up on that. After the third month, proper contraceptive measures have to also be used, because ovulation is erratic. Feeding would be, not complete after 6 months. So other contraceptive measures also should be relied upon. It partially promotes family planning, is what I would say. And it decreases the need of hospitalization because it boosts up the immunity of the baby by supplying the antibodies, and it contributes to the baby's survival, because obviously you have rich food coming in with a lot of immunity boosters. Now, coming to benefits to the mother, it helps in involution of the uterus, because during a feed there is a release of oxytocin, which helps the uterus come back to a normal size. Now, what happens in pregnancy? There is an excessive, to accommodate a baby of, say, somewhere ranging from 2.75 to an average Indian weight of, say, 3.2 to 3.5. The uterus is increasing in size, has increased in size enormously, right? So for it to come back to its own normal size, it takes 3 months. And in the first 2 weeks, from it being about, an intra-abdominal organ, it shrinks to being an organ back to its place by the release of oxytocin, which is released from breastfeeding. When the mother breastfeeds, the brain releases the oxytocin because of the hormonal, negative feedback effect, and that helps in involution of the uterus. So it prevents, subinvolution of uterus, and it also prevents bleeding problems. And again, like I said, it delays pregnancy because of its own anovulatory effects. And most importantly, it lowers the risk of breast cancer and to some extent ovarian cancer. And it decreases the maternal workload because she need not, go and cook food. It's such an easy thing to do. Now, coming to the last phase of this one, it is menopause. So menopause is a permanent cessation of your period for over 12 months or a year, and it happens because of a loss of ovarian activity or ovulation. And median age, though, is mentioned as 50 to 52 years. It can range from 45 to 55 years. That is a longer range that I can talk about. And perimenopause is the period of time that the woman goes through about, say, 7 to 8 years before her before she enters menopause, and a lot of hormonal changes happen during that time. And it is marked by, because of these hormonal changes and because of an erratic ovulation, this is marked by irregular cycles and a lot of climacteric symptoms. Climacteric symptoms are symptoms which start much ahead of your menopause, where you start feeling hot flushes, where you feel low in energy. There are a lot of psychological effects. If you think back, your mother would have been wild at that point. She wouldn't understand. She's not herself. You would see women at that age getting emotional, very touchy, very inflammable. These are the changes which happens because she's not getting enough support from her hormones. And it's basically a physiological event. And people who are blessed and not symptomatic do not seek medical advice. But most women are symptomatic because, estrogen is considered as a brain tonic. So the maximum impact that, estrogen deficiency, which happens after menopause, can do is that it causes a lot of psychological and mood symptoms, which like I said, it's a brain tonic, and without a tonic, you can't, you will have a lot of psychological effects like, hot flushes, night flushes, chills, mood swings. And mood swings is the worst at that point of time in a lady's life. I wouldn't call it pregnancy also. It is most so during menopause. Frequent headaches, lack of sleep, and a lot of rhythm abnormalities psychologically, and an alteration in quality of life because she's not effectively able to function because of the lack of hormones that she always had, an alteration in the mood disorders and sleep disorders, and recurrent urogynecological symptoms like recurrent infection because of immunity also comes down. A lot of pH changes happens in the vagina, which makes her more and more prone to vaginal and urinary tract infections. Osteoporosis usually sets in 5 to 10 years after menopause because bone function and bone metabolism and calcium and vitamin D3 metabolism are largely, and collagen metabolism are largely dependent on estrogen, which is again deficient in a menopausal lady. So osteoporosis is the thinning of the bones, and that makes her more vulnerable to fractures, that makes her more vulnerable to posture changes and posture change related, backache and other, knee related problems, spine related problems, etc. She becomes more and more fragile. The moment she even falls or sits down, she has a fracture. So it's very important to supplement a menopausal lady with calcium. She becomes more and more prone for other medical problems like an early onset, developing diabetes, hypertension, and atherogenic lipid profile, which means hyperlipidemia, and other heart problems. Now, menopause is definitely an opportunity, and it must be taken as an opportunity for a woman to be screened, because that is from men onwards. She'll be more, like I said, more prone to age-related problems and postmenopausal related problems like cardiovascular, diabetic, hypertension, risks, cancer, risk related to cancer. There are some cancers related to the reproductive tract which are more common after menopause, after the age of 60 or after the age of 55. Anemia because of nutritional issues. She'll be more and more depressed because she's deprived of her brain tonic, which is estrogen. She's more dependent on, and she can go into Alzheimer's disease because again that has a connection with estrogen, Parkinson's disease, or any other age-related problems that she might face as not just being a woman but also as general human being. So anything related to age will be more, she'll be more susceptible after the age of, after menopause. Now, hormone replacement therapy can be considered in women who, attain menopause with a lot of climacteric changes, or with women who are young, young women who either going for a natural menopause, say like lesser than the age of 40 or 35, or who go into a surgical menopause because of conditions like endometriosis or somewhere where we have to remove the uterus and the ovaries at the same time. But it has to be used with a lot of forethought, because giving hormones can itself cause a lot of cancers becoming more preponderant over a period of time when used beyond 7 to 10 years, without withdrawal. So a doctor has to be consulted with, doctor herself has to use weigh the risk and benefit of the need for HRT, and HRT has to be used only and if only required and in very severe symptoms. It is better deferred than used. Coming to osteoporosis, like I said, it weakens the bones and allows them to, break easily. And as you go more and more away from the menopausal age, so more the age from menopause, you are more prone for it. And alcohol and smoking can worsen that. Exercise, especially weight-bearing exercise, can, bring down the rate in which it can happen. Proper calcium and vitamin D3 supplements can prevent. I recommend calcium supplementation by our books or by our recommendations. I give it throughout a lifetime for a lady who is menopausal, either by a natural way or a surgical way. She has to take calcium so that she doesn't develop osteoporosis. And her vitamin D3 levels also has to be checked because both calcium and vitamin D3 metabolism are, you work in hand, they have a common pathway, and they are both very important in maintaining the bone density. So both has to be kept in this one to maintain the peak bone mass. Genetic variations can happen in osteoporosis. Medications is like what I said, calcium and vitamin D3. Oxidative stress can be brought down by regular exercise and being on antioxidants like a lot of vitamins and minerals, and regular exercise and a lot of yoga, meditation, pranayama. Again, at that point, regular weight-bearing exercises like walking and gymming and everything can keep her bone mass under control. Preventing inflammation and apoptosis, looking out for other problems is what that means. Problem probably related to connective tissue disorders, and avoid steroid use so that it doesn't worsen osteoporosis. So while there is no cure for osteoporosis, we can definitely prevent it by early screening, be on a watch out for any on that, for that in a postmenopausal woman, proper dietary supplements in terms of calcium and vitamin D3, healthy lifestyle choices like I mentioned before, and prescribed medication as and when required, which will maintain that. There are a lot of injections like, which can improve the bone mass as well. So to put it all or to summarize, for a healthy living, not only when you're pregnant or when you're lactating, for a Jenny lady, drink lots of water, at least 2 to 3 liters of water, which will maintain your normal basic metabolism, not only your food metabolism, but all the metabolism in your body, and which will help in proper excretion of all the, the things that needs to be excreted out. And eat healthy diet. Eat a healthy, normal diet, which is basically Indian, whether it's South Indian or North Indian. Our normal Indian diet is healthy. So rather than going for junk food, instant food, fast food, look out for gluten-free diet. Look out for non-preservative food, which is very important. Be high on vegetables and fruits. That's very important when we say healthy meals. And frequent small meals or meals at an appropriate time, and don't delay meals. Exercise regularly at home at this point of time. Don't go out during COVID. Follow social distancing. Avoid parties. Avoid alcohol and smoking. And sleep at least 8 to 10 hours a day so that your immunity will not be down because of stress. And balance between exercise and sleep and a healthy diet. And do not forget to take your supplements like vitamins, calcium, and be on a high amount of fiber so that you don't have constipation and your intestinal functions do well. And prevent anemia by taking iron so that all these factors can build up your immunity and help you tide over the current situation that we are facing, which is very difficult because we don't even have a vaccine. We don't even have a safe option to either prevent or treat the disease. And your immunity is what is going to help you, tide over this pandemic, which is gone worldwide. It's not just us. Nobody knows what to do with it. Okay? So I would say on your marks, get well and live well. And Ms. Tara, if there are any questions, you can, put it across to me.
Yes, Doctor, we have quite a few questions actually. So what I would like to do is I would like to start off with the generic questions before we get to something which is specific to pregnancies or conceiving. The first question that I have, and I think it's a very, I've heard this question quite often. It's is meftal good to take for period pain? A lot of people I know take that. So that's the first question.
Period pain can be for due to many reasons. Something it can be because of a physiological reason where it is normal, like a spasmodic dysmenorrhea, or it can be because of other conditions like endometriosis or and other situations where this can happen. So which has to be evaluated. So methylspas alleviates the pain related to the prostaglandin release, which happens during menstrual cycle, and that is one of the safe options because mefenamic acid is supposed to be safe during that. But there are safer options like hyoscine or other any anti-inflammatory for that matter can bring down the pain and the inflammation that are released to the prostaglandin at that point. Now, this is a subjective thing, and I cannot say you shouldn't take or you should take, but try to see why you're getting that by going and consulting to a doctor. Make sure it is not a pathology, and then with a prescription you can take it. There's no harm in taking it. But methylspas is a trade name. I cannot promote a particular brand. So it's basically mefenamic acid. So mefenamic acid is it can cause a lot of side effects like nausea, vomiting, and all that. So taking an antacid along with that will prevent the side effects of that drug. It can trigger an acute gastritis. So you will have to also keep some antacid with you to help you out with that. There's no harm in taking it, but there are safer options. If you come and consult us, we'll be able to help you out. We need to rule out other, pathological problems related to pain during periods. It's not just always normal. Most of the time, yes, it is normal. 90-95% it's normal. But 5 to 10% it can be associated with conditions which needs to be treated before it worsens, like endometriosis.
Thank you, Doctor. The next question is it normal to have vaginal white discharge on a daily basis?
Yes. See, I would, any discharge which comes from the vagina is white. There's something called an ovulation cascade or a normal vaginal discharge which happens to a lady during her menstrual cycle. If you're a keen observer, you would have seen that in and around your ovulation time. Now that is a normal discharge. So any discharge which is not foul swelling, which is not causing any side effects. I mean, like, symptoms like itching or, any pruritus or anything of that sort in that area can be considered as a normal discharge. A thick, curdy white discharge or a watery discharge are indicators for, or a mixed kind of a discharge are indicators for a candidial infection or a trichomonal infection or both, or a mixed infection, and that needs to be treated. So that again, you'll have to come back to us. We need to evaluate what kind of discharge it is. But anything to give you a slight, clue, anything which is thick, curdy white discharge or a chalky white kind of discharge, which is staining your panties or which is causing, itching, or which is causing either a foul smell or a fishy odor, is something which you need to come and consult with. It could also mean certain, sexually transmitted diseases also have to be ruled out with certain abnormal discharges. Yes, miss.
Yeah, thank you, doctor. The next question is, approximately on the day of ovulation, I have a continuous pain for 24 to 48 hours, which feels like a pain in the nerves. Is it normal, or should I consider treatment?
Yes, it is what we call Mitchell-Merish, and that is the name terminology which is given for pain during the ovulation time. Some women even see spotting or bleeding at that time. So that pain is normal because when the egg releases out of the ovaries, ovary being a sensitive area where there are a lot of nerves, some women appreciate pain. There are so many reasons why she appreciates pain. It is normal. And some women can even have a spotting or a bleeding at that point, which is again not abnormal about anything.
There's a related question to this, doctor. So I don't know if that answers your point. What does intense pain denote just at the start of the menstrual cycle, like just for 3 or 4 hours at the start?
Yes, it only means that it is a spasmodic dysmenorrhea. See, I would just show it if you can see. You can see my hand here. So if you consider this as the mouth of the uterus and this is the uterus, this is from where the bleeding starts and this is from where it has to go. So sometimes the mouth of the uterus it has to, it is very tightly closed. And when it has to open up so that the blood comes out. So the first few hours, prostaglandin is released and you need to open up that passage so that bleeding happens. So when that happens, it causes pain. Cervix is the mouth of the uterus. It is the most sensitive area in the whole of the reproductive tract. So when it dilates, like in labor also, you have pain, right? So when it dilates, the initial few hours, when it has to dilate enough for the blood to come out, it tends to cause pain. So that is why a spasmodic dysmenorrhea happens for 3 to 4 hours. Anything more than 1 day or 2 days and increasing to 3 or 4 days is not spasmodic dysmenorrhea. You have to evaluate that for endometriosis and other conditions or a fibroid or whatever related to which is causing pain in the mouth of the uterus.
Thank you, doctor. The next question is spotting instead of a period normal?
No, it is not normal. So anything that is formed in the inner lining of the uterus, which is particularly formed because you need to hold a pregnancy. So every cycle, the inner lining of the uterus is formed so that if you are pregnant, it can hold it. Whether we want it or not is a different thing, but the uterus is prepared for it. So if there is spotting instead of bleeding, it means if there is an oligomenorrhea or a hypomenorrhea, and it could indicate diseases like, either PCOS or tuberculosis of the genital tract, of the uterus, etc. So it has to be evaluated.
Thank you, doctor. Next question. I believe there is someone who has been told that she has a bulky uterus with cervical fibroid issue. What is this exactly? How can it be cured? And how threatening is this issue for pregnancy?
Any lady who has delivered as a child will have a bulky uterus because uterus, anything that expands cannot come back to its same elasticity or tone, right? Like you expand a balloon, it cannot come back to its original shape and size. So the uterus is always like, it's also like that. So after a delivery, your uterus will never be into normal size. It will be a little bulky. But when it is bulky usually beyond a particular, size. When it is, you call it bulky, it is because either there is a fibroid in the uterus or there is any adenomyosis in the uterus, or there are other things which can cause, like there are a lot of dysfunctional uterine bleeds which are also related to a bulky uterus. But in her situation, she has got, like I said, there is a uterus. I shouldn't be discussing this, and because she has asked me this question, I'm telling this. If this is the mouth of the uterus and this is the uterus, she has got a fibroid here. So it will overall increase the size of the uterus, and that's why it is looking bulky. So it has to be removed, otherwise it can cause problems for you.
Thank you. Thank you, doctor. So we'll move on to a couple of questions related to pregnancy and then open it up for final questions. So, and this is something that a lot of the audience has asked, is that should I conceive? What tips would you recommend if I want to conceive? If I have thyroid, if I have PCOS, how will this affect the baby? Is it safe? And I mean, in the dire situation of the pandemic, is it even safe to conceive at this point, or should I do it later?
I have no right to say you shouldn't conceive, because that's the priority which every woman has, and that's something which I cannot say no, you shouldn't conceive, because there are a lot of subfertile couples who are just waiting to conceive. But given a choice, if you don't have any other complications, and if you can give it another 2-3 months time, it is definitely not advisable to get pregnant at this point of time, because like I said, it's an immunocompromised state. So it is like any other immunodeficient person, like, people on immunosuppressant drugs or people on immunosuppressant therapy who are getting pregnant. So you're more prone for a disease, and especially a very aggressive disease or a pandemic like, like COVID, and where we don't have a proper treatment option other than, so keeping your fingers crossed and pray hard that nothing should happen to you. Given a choice, if you are young and if you are not frantically wanting to get pregnant at this point, it is always better not to conceive now. That is why we have put all infertility treatments like an IVF or IUI on hold. We are given government directives not to initiate any treatment other than a natural, intercourse or support with a follicular scan. Right now, we don't have by government directives, by the guidelines of any obstetric and gynec society or by the ICMR or WHO, all treatment protocols are put on option. But I cannot say as a doctor or as a woman, I cannot say, please don't conceive. If you know the implications, if you know what you are gearing up for and you badly want to be a mother, I cannot say not to do that. But these are the implications and these are the things you should expect, when either during the process of your consultations or during the process of pregnancy or during the course of your delivery or during your lactation period, you are prone for infection. And it's not a small infection we are dealing with.
Thank you,
Yes.
doctor. The next question is how does early sugar affect pregnant women, and will it be gone after the delivery?
See, early sugar means diabetes complicating pregnancy. There is a difference between diabetes complicating pregnancy and gestational diabetes. Gestational diabetes, we would say it is diagnosed after, say, 20th week of pregnancy, that is, and then which disappears after delivery, or at least 6 weeks postpartum or 3 months postpartum, post-delivery, is what we call gestational diabetes. If you say early pregnancy with diabetes, we put it under diabetes. It is very important for the sugars to have been kept under control. There is a test which we do, which we call HbA1c, which is the glycosylated hemoglobin that we test. This measures the average of the last 3 months of sugar. So if you know you're pregnant and you're also a diabetic, and we do a HbA1c and it is more than 6.5, your baby is prone for congenital abnormalities related to the heart, to the brain, to any system in the baby, and you are also prone for trisomies like Down syndrome, etc. So it's very important for us to, evaluate that blood level and make sure that that lady has had HbA1c below 5.5 or so that she is not prone for carrying a congenitally abnormal child, because abnormal sugars in early pregnancy because that is where the conception happens, right? So that is where the deformities happen. So during that time, if she is, her sugars are not under control and her HbA1c is more than 6.5, she has to be screened for abnormalities while we do a 3rd month or 5th month scan. She has to be given an option of termination if she is worried whether she would be carrying an abnormal child. So it's very important. Yes,
Thank you, doctor. So moving on, I think we'll close the session in another couple of minutes, but we do have a couple of more questions. What can be done if we have on and off period we have on and off periods in a month and muddy discharge sometimes? Okay.
It only means there is, an abnormal bleed, which can be either a dysfunctional uterine bleeding or wherein it is just a hormonal imbalance. There are a wide range of hormonal imbalances which we have to evaluate. There could be a pathology in terms of something related to the uterus, to the ovaries, to the brain, to the hypothalamo-pituitary axis. So we have to evaluate and rule out a pathology. We have to evaluate and rule out any hormonal imbalance. You will have to come to hospital. We'll have to get a scan done. We'll have to do a hormonal titer. We have to rule out, any other symptoms or signs that we see which can help us diagnose and help you.
Thank you, doctor. Next question. Is it okay to have breast stiffness and tenderness as PMS? What is the reason behind this? Because apparently this is a new development for this lady. How do I avoid this?
Okay. See, there is one entity called premenstrual mastalgia, which means that they get cyclical pain just before the period, which may start, say, 5 to 10 days before her next expected period. So this is because of the hormonal changes that happen during the second half of the cycle, wherein you have a up and down of progesterone that happens just before your period, and there's an absolute withdrawal of progesterone before the period. And once the estrogen comes in again, after the period, her pain disappears. But it could also be because of certain pathologies like, hypoplasia and other things which had to again be evaluated. A self-examination of breast for any fibroadenoma or any other condition is required. An evaluation with your gynecologist to rule out any mass like fibroadenoma or any other hormonal imbalance like a hypoplasia has to be ruled out before I could say it is just a premenstrual mass strategy. The mainstay of treatment for that would be treatment with vitamin E, which has really given a lot of relief, and correct hormonal imbalances. Treatment with evening primrose oil has also been one of the mainstay of treatment. Sometimes it can be very annoying and very depressing because the pain is very excruciating. So painkillers are also given during that time. And all hormonal imbalances have to be corrected. So you really require an evaluation there as well.
Thanks, doctor. Then shall I ask the next question?
Sure.
Yeah. Okay, so we have a question actually related to nutrition. The question is just simply written, are greens safe to consume now? So I'm not sure if that's something that you would feel comfortable answering. That's one question, and the other one is regarding natural ways to deal with thyroid issues.
Forget greens, even water, I don't know if it's safe to consume at this point of time. What we can do is for the greens to not cause anything, make it red and create a pandemic. We have to wash it regularly, so with warm water and with a pinch of salt in it. These are the two effective ways in which you can disinfect this one. Obviously we can't use soap and water, so we have to do something. Cook your food well, and better avoid taking greens like we say fresh, because we don't know whether it is contaminated. So cooked food at this point would be always better. And greens related to hypothyroidism, I would say, see, certain foodstuffs have a goitrogenic effect and it can worsen hypothyroidism. So the things the foodstuffs which you need to avoid to prevent a worsening of hypothyroidism and further destruction of the thyroid gland in hypothyroidism related to autoimmune problems would be the goitrogens, which we say you have to avoid, are cabbage, cauliflower, and broccoli. If you can avoid that, you can prevent the worsening of disease. Nothing else can help you. It is a natural destruction, and whatever amount of thyroid hormones are required for your normal general functioning of your systems and your psychological and mental function, that has to be supplemented. So it has to be supplemented by giving thyroxine. There is a limit to which you can decrease the requirement by following a healthy lifestyle, avoiding foodstuffs of this kind, and follow exercise and meditation and pranayama and yogic exercises. But you cannot stop disease because it's something which is happening. You can't do anything about it.
Got it, doctor. Two questions related to PCOS. One is, someone has said that I'm the only one in my family who has this PCOS. My mother does not have any issue with periods. You had mentioned genetic risk earlier. I think this is a response to that. This is one question. And the other question is, how can we know at what stage of PCOS we are in? I have a 45-day cycle and I have PCOS. This lady is 30 years old.
See, PCOS is a wide range of problems. There are about, I think, criteria-wise, we need to fall into at least 3 criteria. So it's a wide range of problems. It has to be evaluated. Being a hormonal imbalance, The mainstay of diagnosis and treatment is not by doing a scan. That scan is only a supplementary option. It is more by doing because it's a hormonal imbalance, we need to evaluate the hormones and see how severe it is. She'll have to come over so that we can do those hormonal tests and see how severe it is and modify, that accordingly by giving, whatever is required for her. And earlier it used to be treated with hormones, but I don't touch hormones for the last 10 or 15 years at least, because it has its own long-term side effects. So modulating your, lifestyle and healthy, this one, diet and exercise and giving regular withdrawals is a much better way. And modulating the effects of the gene by giving either an acetylcysteine or, mainstay of treatment has always been metformin without any side effects, because it is an insulin sensitizer. It's the best mode of treatment. What was the other question, Ms. Tara? It just slipped out of my mind, related to PCO. She wanted to know.
One was the lady who said that she has PCOS, but the mother does not have. And the second question was at what stage of PCOS? Those are the two questions.
See, mothers are not the only mode of transmission. She would have got the effect from the father also, because the gene is the same. Like, whatever causes insulin resistance can probably one of her parents or grandparents or anybody in the family would have had a gene which is either having, which would have either come out as PCOS or as diabetes. One of that would be, presenting in the main manner. In one of these manners, it would have presented actually. So there, and of course, mutations are always a part of any genetic material, right? Mutations are something which can start from her. So the total, the overall reproductive function, the overall total number of eggs that are there inherited by a lady for her lifetime. Now that we are dealing with a reproductive problem, age problem, PCOS is during that age. The total number of eggs that she would inherit for a lifetime is first recruited when she is 16 weeks in her mother's womb, and the final recruitment happens when she is born. And then from the time of menarche, that is from the time she gets her first period, these eggs have to be used up till, menopause. And so only as many eggs that she has would be the, amount of time she would have a reproductive age, or, the age till when she will get her period. And if her reserve is already down, she can show symptoms of PCOS, and, there can be ineffective ovulation like 45 days, and you can have all these things. So it is not only the gene, it is also what you inherit, the number of eggs that you inherit. It is a complex problem which I cannot say it is this or it is that. This is the most accepted hypothesis. These are all hypothesis state. It is a very enigmatic disease. We don't know the actual cause. This is the most accepted hypothesis, and this is the most accepted, mode in which we can treat. And the lifestyle modifications are the most important. That is what can modify the effects of the gene, along with medications if required when it is very severe, and regular withdrawals.
Got it, doctor. Thank you. So we have closed Q&A. We have the last 3 questions here. So because I know that we have gone ahead in time. Last 3 questions. What reason can be if there is blood drop from the stool?
Blood drop from the?
Blood, okay, I'm just reading it out. I think they mean that there's blood in the stool. What reason can be if there is blood from the stool?
A little away from my department, but it's very close to mine as well. See, any bleeding from the stool could be because of something like hemorrhoids or a pile mass, or an internal hemorrhoids or a pile mass. It could just be that she has had a constipation and she has hurt herself while passing stools by forming a fissure. A fissure can bleed from there. There could be a hookworm infestation which can cause bleeding per rectum. And there are umpteen number of problems related to the gastrointestinal tract, like a Crohn syndrome or a typhoid ulcer, or ulcerative colitis. There could be a lot of cancers which can cause bleeding from there. So it ranges from something very normal or an infection to an as serious situation as from to a bile mass to as a serious situation like cancers. So that has to be evaluated by a gastroenterologist or a gastroenterosurgeon, people or a surgeon who deals with. It's a little away from the reproductive tract, but since it's very close, we often get affected by it.
Got it. Thank you, doctor, for answering that, even though it's not a part of your expertise.
Especially in terms of pregnancy, bile masses and hemorrhoids worsen because of the intra-abdominal pressure. So we do deal with a lot of bleeding per rectum. Fissures are very common because of a lack of fiber in the diet, or drug-induced constipation, which can cause bleeding per rectum. Hookworm infestation can cause anemia, and it can affect the pregnancy as well. So these are the three things which we usually deal with, but there are so many other factors.
Got it. Thank you. Then the penultimate question, two more to go. I have flesh immediately in the vaginal mouth. I think that opening, I think she means. Is that an issue?
How old is she?
She has not mentioned that, but I can send her a response if that will make it.
Third patient, or little in and around menopause, or a little later than that. I don't know if she would be working then, but it could be because of a weakness in the vaginal, mouth of the in the vagina, which is the cavity related things. Usually, it happens after delivery because there is an ironing out of the vagina. It can also happen in a condition called a prolapsed uterus, wherein the uterus and the vagina and the cervix, the mouth of the uterus, start descending because it changes its position and there is a weakness in the ligaments which hold the uterus. So there again, she'll have to come over and we'll have to evaluate. It's very difficult for me to just say it is this, or it would be this, or it would be that. She'll have to come over and have to evaluate.
Got it, doctor. Got it. I think she has got the advice she needs.
Yes.
Yeah. Thank you. And the last question, what is the use of Susten 200 tablets for vaginal use during the first trimester of pregnancy?
Again, I would say Susten 200 is a trade name. I'm not supposed to, propagate any trade name. It is basically natural progesterone. Okay. Now, many women, and of late, many women, especially the ones who have had difficulty in, ovulation, in terms of PCOS, in terms of subfertility, they all have a condition called luteal phase defect. So it's usually the second half of the cycle where progesterone is released from the body, and progesterone is mainly released from the ovaries, from the ovulated follicle, to support the pregnancy for the first 3 months of pregnancy. So it is not the placenta, it is the released follicle which releases progesterone, which supports the pregnancy in the first 3 months of pregnancy. Now, certain women have a luteal phase deficiency, they have a progesterone deficiency, and from the 14th day or from the time of confirmation of pregnancy, if they are not supported, they can end up in abortions. So basically, this natural progesterone in 200 or 400 milligrams, or sometimes even when they are used intravaginally in infertility and IVF patients, we use it at even 800 milligrams per day, is used to support the pregnancy in a patient where the natural progesterone is deficient, or in a patient where they require more support than usual. When the inner lining of the uterus is thin, or they have stress and strain of any kind, especially lockdown, you don't have your maids helping you out, or you have a subfertility, you have conceived, you have a long distances to travel to work, you are basically a PCOS, you are a patient with other medical problems, you need support till the 3rd month, till the placental takeover at 14th week, we do support with natural progesterone. So it is, we use the dosage of 200 or 400 or very rarely 800 intravaginal, because more than that it could be, it could have its own side effects. for supporting the first 3 months of pregnancy in a patient where there is a luteal phase deficiency or a luteal phase deficit of progesterone.
Thank you so much, Doctor. And with that, we close today's session. That was very, very informative. Again, thank you for your time. And I thank all the Amazon employees for participating. If you noticed, audience, we have put a feedback link in the chat box. Please go ahead and share your feedback. We would really, really appreciate your valuable feedback so that we can better our services. Dr. Kavita, it was a pleasure having you today. I thank you once again for your time.
With you, Ms. Tara. Thank you so much. Thank you all for coming in and, watching and actively, proactively, doing this session. Thank you so much. Thank you.
Thank you, Doctor. Thank you.
It's my pleasure to do this for you. Thank you so much.
Thank you. With this, we end the session. We will be closing it in the next 5 seconds. Bye, Doctor. Thank you.
See you.